I want to give you an idea of how treatment progresses. We're looking to make this a relatively seamless dance in terms of how the work actually works versus a technique that you do for a set period of time and then stop it, and then you do something distinctly different and stop that. Well, there's absolutely nothing wrong with that approach. It's always been my way of both teaching and treating, where we try to make this a little bit more spontaneous, if you will, free form, almost like modern dance, where you're not necessarily choreographing everything ahead of time. So if Melissa was coming into me for issues of voice or swallowing, and I started with some engagement in the general region of the hyoid, and Melissa's staying quiet during this whole video here, but I would be in constant contact with her, seeking out relevance, making sure that whatever it is that I'm doing, she's recognizing as familiar, not only familiar, but useful and helpful and not provoking. She could be quiet as we do this, she could be voicing, she could be swallowing, she could be singing, she could be doing whatever it is that brought her into my treatment room here. But if I found something in the general region of the hyoid, I'd hang out with it for a while. Eventually, I get curious and want to move elsewhere, or my hands begin to fatigue, and it's really easy just to move a bit. And whether I stay bilateral or I move to one side and maybe test the waters, play around. I've taught you techniques, but I make new techniques up literally every day if a new technique is something where I don't normally put my hands, because this is a technique that I teach in my class, but maybe this doesn't quite connect in the same way as that, or this, or in through this area. I'm going to be moving my hands around. If I connect with something there, we'd stay put for a while. But she may start to tell me about some sensations up in the hyoid, up at the base of the floor of the mouth, the base of the tongue, etc. And after 3, 4, 5 minutes of that, the dance brings us up in through here. And I wander around looking for relevance. Melissa's feeding back to me, yeah, that's it, or no, not quite, I don't feel anything. I want to stay in contact with relevance at all times. She may begin to get sensation or report things to me down in the lower aspect of her rib cage. It easily from here make the dance so I come down in through here. In the seminar, we start treatment here, but that's not necessarily how treatment actually works. We start down in the abdominal, the upper abdominal, the lower thoracic region for a few reasons, mainly to give you the idea how to get the feel for this work, but in reality, you can go there anytime. I want to always be allowing the dance to stay in contact with whatever Melissa feels as useful, as helpful, and as relevant to the symptoms that brought her in to see me.